The COVID-19 crisis has presented us at Silver Hill Hospital with a number of challenges, and our primary goal throughout is how to keep our patients and their families safe, as well as our staff, while at the same time keeping the quality of care that we provide for our patients with mental illness and addictions as high as possible. I'm proud to say that we've been able to adapt quickly to this crisis by instituting a number of protections around the campus that have minimized the risk of COVID-19 infection in our patients, in their families, and in our staff. And that has enabled us to really keep the quality of our treatments unchanged throughout this crisis. Let me tell you a number of the things that we're doing so you're aware of how we are coping with this crisis. First, we're instituting a number of infection control standards throughout the campus that limit the possibility of exposure. Starting with, we are monitoring temperature and symptoms in all of our patients and all of our staff twice a day. That way, we would know if any of our patients are developing a fever or if they have any symptoms compatible with COVID-19. And if that were to happen, we would immediately keep them from spreading that virus to anyone else, and if those symptoms warrant, get them the medical attention and/or testing that they need. Similarly, we've asked all of our staff to monitor their temperature and symptoms before coming to work every day, and as well at the end of the day, and to immediately either leave the campus if they're already here or not come to work if they're suffering from symptoms. That effectively keeps our staff from being on the campus if they're in the most infectious stage of the illness when they're symptomatic. And this has already led to staff members who have become COVID positive not being on the campus when they were in the infectious stage of the illness, and therefore protecting our patients from becoming infected. For patients and staff on the campus, we have instituted a mask policy for everyone. That is, all patients and all staff wear masks all the time when they're in the presence of other individuals. That is, patients with other patients, patients with staff, staff with patients, but also staff with each other. That minimizes the risk of the virus being spread between our patients, between our staff, or from one to another. As you can imagine, that's not convenient or comfortable for anyone. None of us enjoy spending our days wearing masks, but we felt that it is crucial to keep the infection from spreading on campus. We've instituted a number of policies in order to keep the likelihood of the virus coming onto campus at a minimum. For example, we have eliminated all in-person visits from family or other professionals to the campus and have replaced that with full virtual visits. That means all patients on the campus have access to iPads and other electronic devices that enable them to Skype or use other virtual means for communicating with their family members or loved ones. Our outpatient program has moved entirely virtual, so none of our outpatients are coming physically to campus any longer. They are meeting with their therapists completely virtually. Staff members who had previously seen private patients have now moved those visits completely virtually as well. So essentially, the only people coming to our campus right now are those staff members who need to be here in order to care for patients. Staff members who perform any functions that can be performed remotely, that is administrative staff or other areas of our staff that can do their jobs from home, are doing so. And all staff meetings have been moved virtually, both for those staff members who are not here, but even for staff members on the campus, so as to minimize contact between staff members on campus. Last but not least, we have moved the programming for our residential patients, that is those who are here in the transitional living program, into the houses themselves, so as to minimize or eliminate the contact between patients from different programs One of the unfortunate reactions to very stressful situations in some individuals is to think about wanting to harm themselves or even wanting to take their own lives. I want to urge anybody who's having feelings like that to reach out right away. There are services available and we can get you help. If you feel acutely in danger of harming yourself, please call 911 and emergency services can take care of you. If it's a little bit less urgent, you can call the American Foundation for Suicide Prevention hotline at 1-800-273-TALK. And if this is something that's gone on longer and you'd like to engage in treatment, whether it be outpatient, residential, or inpatient, please call our admissions office at Silver Hill Hospital at 1-866-542-4455.